I wanted to start by just letting you know some of my disclosures that are related to my talk. I should have also mentioned that I have current funding from the publisher Biomed Central and the Cochrane Library that may well be related to some of what I'm going to talk about today. I thought I would give you a quick outline. I think it's important to give you some context about what do we know about the quality of published research in biomedicine, and a little bit about reporting guidelines, and something about proposals, something about open science and about registration. And I thought I'd give you the takeaway summary now so you could sort of have a little sleep here while you wait for the next speaker. Reporting guidelines are a useful intervention, and I hope to be able to show that to you. I've got intervention in sort of quotes because they're not really an intervention. The journal is the real intervention. I think reporting guidelines, again, are probably not the best name for proposals, but they are probably a useful roadmap for people to consider. And probably most importantly, reporting guidelines are quite useful for peer reviewing, and we have nice randomized trial evidence for that. And I would just sort of like to say that we do have sort of a responsibility for open science, and I'm going to talk a little bit about that. I know that last year I gave a webinar on some of this material. I had a little look at the slide deck, and I think there's a little bit of overlap, but not too much overlap. And so what I thought would be good is to sort of give you some context. This is from the Lancet series, the Waste in Research series, where you sort of see that these columns really, they really represent, this is probably dying now, they sort of represent the spectrum of research, really starting at what's the question you're asking, is it a relative question, all the way through to is the methodology you're using useful, are you doing some trials efficiently, and you heard Sean talk about that, right along to the other end of the spectrum where is the research that we've done, is it accessible? Sadly, much of it is often not accessible, and even of accessible research, even if you can get hold of it, can you understand it? And so I've spent quite a bit of my career, thank you. I've spent quite a bit of my career sort of looking at this end here, looking at the, once it's done, what do you do with it? And now I'm sort of one of the reasons I'm at Stanford is I'm looking at the other end as well. So what I do want to say to you is unfortunately, the published record is quite tarnished. And for funders, this is obviously a huge waste of money. And the good news about it is it's avoidably wasteful. If I stood up here and told you it's wasteful, there's nothing you can do about it, you just have to live with that, that would be really unfortunate. The good news is you can actually avoid a lot of this waste. The question is, how can we avoid that waste? So Paul Glasio very nicely in the Waste in Research series in the Lancet really gave us literally hundreds of references of waste in research, and I want to really point out that that is waste in research, not just in clinical medicine, but in preclinical, in animal research, in genetics. So it's right across the spectrum, and I think we need to be sort of worried about that. So here's a very simple little example of a group of authors looking at oncology trials. They went and looked at some pretty basic information, and what they found is that overall, very, very few of these trials had reported this information in their publication. So if you have a successful cancer drug, but you don't tell the reader the name of the drug, it doesn't matter how effective it is, a clinician will not use it because they don't know what the name of the drug is. If they don't tell you the dose of the drug, they're certainly not going to be able to use it. That's wasteful. That's avoidably wasteful. And we ought to be really quite worried about it. And in an accompanying editorial in this piece of research, Dancy very nicely sort of pointed out the problems of going from best evidence to best practice. So if we do not completely and transparently report what we've done, we are not going to make that transition from best evidence to best practice. That is a huge problem across the spectrum, not simply cancer trials. Here we are. We looked at reporting of systematic reviews in 2007 and 2014. Well, not 2014. We looked at it in probably a 10-year interval, published in 2007 and published in 2016. And while we see some improvements, which is very encouraging, we see that there are other areas of reporting of systematic reviews where there is no improvement. So that's increasingly problematic, and we need to figure out how can we deal with this waste. I'm sure most of you have seen this piece of research in the psychology literature. These authors were quite interested in replication, particularly replication of results. And so what they did is they took 100 psychology experiments and they tried to replicate the results with the authors of those 100 studies. And what they found is that they could only do that in 50% of the time. So 50% of the time they were not able to replicate the results working with the authors of those studies. Well, that is obviously very wasteful and very problematic. And I'm just going to end with a few slides. If you haven't looked at the COMPARE project, I would encourage you to go to the website. It's very important. It's a very simple, sweet, elegant study. What these authors did is, led by Ben Goldacre, they went and they looked at the top 5 journal impact fact journals, and they looked at the reporting of randomized trials over a 6-week period. They compared the published report against the registry information. And what they found across the 67 trials, what they found is that, I should state that they looked at only one thing, outcomes. They were simply looking at primary and secondary outcomes. And what they found is that there was agreement in very, very few of them. And I would encourage you to look at the website, because the result is interesting, not so much that there's obviously this tremendous disconnect. The results are interesting because there are many letters from the journals involved about this, and they're highly informative about what we think of research and how research is done and what sort of research is published. So I would encourage you to look at that. I don't think there is a publication of the COMPARE project at the moment. I really also want to include the sort of translational colleagues I have who are doing preclinical research, because we often forget about those, and often these people think that their world is good. There are no particular problems in the preclinical world. Here is simply one example of the sort of methodological quality of animal trials. Here is Malcolm McLeod went to look at sample size calculation across 8 different models of research, animal models, research such as Alzheimer's disease. And what they found is that the vast majority of these trials had no sample size calculation. That's obviously problematic, it's wasteful, and it's avoidably wasteful as well. So this is preclinical research. If we go upstream from published to protocols, we find that protocols are really not so well developed. There are some very key problems. If we simply look at 2 of them, or even one of them, allocation concealment is obviously a unique feature of a proposed randomized trial. And if there's inadequate information at the protocol, it's certainly not going to become adequate over time. So this is a very wasteful situation, and it's not a good idea for funders to be spending money to fund such trials. And it's certainly not a good idea for people to be participating in them. So my take-home message to you is that all of these have passed peer review. All of these papers have also had editorial approval. This is super expensive and super wasteful, and so we need to figure out how to deal with that. So how do we get to this situation? Well, I think there are many reasons. One of them is certainly that researchers don't know what's expected of them when they're writing protocols. And so I get lots of interesting correspondence as an editor. And here is simply an example of the correspondence, of a recent correspondence I've received. We've completed a systematic review and a meta-analysis on a given disease. So they're looking at thickness of arteries. And so what do they want? They wanted to know, having completed it, where do they get a registration number? And they wondered, where does the protocol fit in all of this? And so these are people, well-meaning people who have done a systematic review and meta-analysis and really are unsure about the process. So this is simply one example of sort of correspondence that I receive, and it leads me with many other examples and a lot of other evidence that it's often researchers do not know how to prepare a protocol. Sort of beyond that, prospective authors really don't know what's expected of them in a research study that's been completed. Journal instructions to authors are very good in telling you what font size to use, whether to use particular type of reference style, but they're not so good at telling you about science. And I would have thought that that would be a good place to tell people about science, particularly authors. And we also know that the editorial oversight and peer review is fantastic. I can tell you that anybody in this room who's done peer review, just like me, you've never been trained. So it would be akin to getting on an airplane, looking left and saying, well, I'm sure the pilots know what to do. I'm sure that they've been trained. And that's what we have in biomedical research. We have no training for peer reviewers, and we have no training for the journal editors, the men and women who are running these journals. So that's a huge problem. One of the reasons I'm at Stanford at the moment is that I'm delusional enough to think that we could actually come up with some standards to train people. But we'll see whether my delusion can be treated. Another reason that we're in this situation is to do with academic promotion and how we assess scientists. So there's really one song that is sung in academic institutions: publish, publish, and publish. And sometimes they say published in the highest impact factor journal you can find. And until we change that process, until we give different incentives and rewards, we are not going to get out of this situation of publishing essentially rubbish that cannot be used by clinicians and others. So we need to change that. And there are some places, and Europe is certainly leading some initiatives such as Science in Transition, where they are trying to reward team science, they're trying to reward data sharing, they're trying to reward replication, and trying to really decrease the value put on publications. It's very easy to get published, extremely easy. And so we need to look at a movement away from these metrics. And if you're interested, I would encourage you to look at the Leiden Manifesto or DORA. There's lots of others. So we do have some interventions that could be used that might improve the situation in 2016 going forward. And one of them is reporting guidelines, which are essentially checklists, some reporting guidelines for flow diagrams, and along with the checklist is some sort of explicit text as to how to sort of operationalize the checklist. And a reporting guideline, an important part of that is a consensus process. And I should say that well-developed reporting guidelines are simply a minimum. I often receive correspondence from people saying that they've done other sort of things in their trial, but they don't know where to put it because it's not in reporting guideline A. And I sort of say, well, don't worry about it. Just put it in there. It doesn't matter where it's in there. Your obligation is to tell the reader what you've done and what you've found completely and transparently. So I think they're what's important in terms of reporting guidelines. So I would say to you that in developing reporting guidelines, I think there are probably 5 essential steps. One is to seek relevant evidence. about the quality of reporting on the particular sort of domain you're interested in, such as this morning we heard about pilot studies, feasibility studies, and there's all sorts of different types of studies as well. And then I think it's quite useful to develop some sort of pre-meeting activities. Often reporting guidelines are associated with Delphi exercises. I believe a face-to-face meeting is very important, or some sort of consensus is very important. And post-meeting activities are essential as well, as is post-publication activities. They seem to me to be essential stages in the development of reporting guidelines. And what I think are important attributes of good reporting guidelines is that whenever possible that they're quite evidence-based. It's not a group of people simply asking prospective authors to report on this information because we're a high and mighty group and we think it's important. That is not the way to move forward. I think the way to move forward whenever possible is that evidence of not reporting this information can introduce bias in the treatment estimates. And we want to move away from biased treatment estimates. It's very important to involve editors from the beginning, because at the end of the day, the real intervention of a reporting guideline is that editors need to introduce it to their journal. And if editors are unwilling to introduce it to their journal, then it's not going to be effective. It's not going to happen. We're not going to find a way to improve reporting. I think we need to think about our reporting guidelines evaluated. And the evidence that I'll show later on is that few reporting guidelines have been evaluated. The analogy to that, for me, is that it would be having a drug on the market and it's not evaluated. I think that would be quite problematic. So I'm going to go through some reporting guidelines with you. Here is the CARE reporting guideline for case reports. Case reports are very popular in some parts of biomedical medicine. Here's sort of the checklist, or part of the checklist of the CARE guidance. Here is the latest iteration of the consort statement with the checklist, and as I mentioned, it has a flow diagram to really provide for you to provide readers with the sort of the flow of participants through various stages of the trial. The spirit statement, which I'm going to come back and talk about later on, is a checklist for protocols of randomized trials, and PRISMA is a checklist for reporting completed systematic reviews. So let me simply give you some examples from PRISMA. As we ask authors to give the numbers of studies screened, assessed for eligibility, and included in the review, with reasons for exclusion at each stage, ideally with a flow diagram. And here's an example, I think, of a well-reported flow diagram. It's giving you, in each case, the number of studies included in each of the meta-analyses. And I think that's very important. That's very clear. That's very transparent. The rationale for reporting that is quite simple. I don't know in Ireland whether the X-Files is a show that was here, but what we want to move away from is sort of things disappearing. I often read that they screened 2,400 studies and they included 2. Okay, well, what happened to the 2,300 studies? Where did they go? And we need to know that as readers. We need to be empowered. We need to know that. So I think there are lots of rationales for why we need to provide readers with information. So we often use, here's an example from PRISMA P, which is a PRISMA guidance for protocols. We often include an explanatory paper, which is often a very long paper, which typically includes examples of good reporting, the rationale and evidence underlying why we're asking people to provide this sort of information. I would encourage you to go look at the Equator Network. It has a fabulous library of reporting guidelines. There are well over 300 completed reporting guidelines, and there are a great many more in development. I certainly can't keep up with it, so I would tell you, go look there and see if you see anything that is useful to you. So I wanted to point out beyond the library of reporting guidelines, it also includes lots of information in various toolkits. So there is information for authors, for those of you who are editors, and teachers, and maybe you have other roles in your daily lives. There's a lot of information you can get that's useful on the Equator Network, and I would encourage you to go look at that. Here is information particularly for authors, planning and conducting your research, and so you could go and click on that, and it's going to pop up a lot of different references and guidance for you. So the question you might be asking is, why should we use checklists? Well, one is there a way for authors to remember what they've done. And typically, clinical trials, well, not typically, there are many clinical trials that last longer than 3 weeks. And sort of at my age, I can't remember what happened yesterday. So you might need something to nudge you about, okay, how do we do this? Maybe you've sort of written that down as you've been doing the trial. But there's certainly a way of providing guidance to authors in terms of what did you do at various stages. I think they definitely can facilitate critical appraisal during peer review, and I'll come back to that. And it really puts everybody on a level playing field. It puts the authors, the peer reviewers, and the editors on a level playing field. Getting published is, there's no secret ingredient. And if we are all on the same playing field, we all know this is what you need, then I think the process is going to be really, really much simpler. I've not put on the evidence yet as to whether reporting guidelines work. This is some recent work from one of my PhD students. The issue around reporting guidelines is actually their endorsement and implementation within journals. And we see an increase in endorsement, at least of the consort statement, over time. But as you can see, it's far from being perfect. There are still a good number of journals that have not endorsed the consort statement, even though they said they have. So there are different ways that people are also endorsing the consort statement, and it might be analogous to actually having a different dose of a drug. So we need to consider about that. And so we, in our group, did a systematic review looking at to see whether consort worked or not. We evaluated more than 16,000 randomized trials that were included in over 50 studies. So here's an example, again, of allocation concealment, a very unique and important characteristic of the randomization process. And what we did is we compared the quality of reporting in endorsing journals versus non-endorsing journals. And what we see here is an example that endorsing journals, the quality of reporting of allocation concealment was significantly better than non-endorsing journals. So that's optimistic, it's positive, it looks good. And if we go across all 27 items, we see that some are statistically significant, but probably what's far more important is that many of the items are moving in the direction that we would want them to move in. So that endorsing journals appear to have a higher quality of reporting than non-endorsing journals. So Eric Cobo has done a very nice randomized trial using reporting guidelines, in this case consort, as part of the peer review process. And what he's found is that peer reviewers who were randomized to receive the consort guidance, that the quality of reporting of the manuscripts that they were peer reviewing was higher than those randomized not to receive the consort guidance as part of the peer review process. So I think that that's a nice example, a nice randomized trial example of some sort of useful evidence as to whether consort is effective. We've also looked at whether other reporting guidelines have been evaluated. And sadly, the vast majority of them have not been evaluated. And I think this is very problematic. We can't be asking people to use reporting guidelines where we don't have an evidence base for which they are moving in a direction that we want them to be in, namely improving the quality of reporting. And I think we wouldn't want pharmaceuticals or surgical procedures or anything else on the market without evidence of effectiveness. So I think we as reporting guideline developers really need to do a lot more work to include evaluations as part of the process. So moving along to proposals, why are proposals important? Well, they definitely provide a roadmap for, what are the intentions of the research group. And they can reduce bias and enhance vigor. So they can potentially reduce selective reporting bias in particular, which is what the COMPARE project was principally looking at. They can definitely potentially reduce duplication of effort, and I will come back to that in a moment. And they can assist in the critical appraisal of what the research are proposing, and I think importantly they can enhance transparency and uphold integrity of research. So what do we know about selective reporting in primary studies? And if we look at the clinical trials literature, we know that there are significant differences between the information that's in a protocol about outcomes and information that's in published research. And if those trials are included in systematic reviews, then that's going to be obviously quite problematic. And the question is, do systematic reviewers suffer from similar issues of selective outcome reporting? And indeed they do. And this was one of the first pieces of evidence came from Chris Szilagyi looking at the Cochrane Library some years ago. And unfortunately, we see that as a continuing problem in reporting of research. And what we think is that if we develop protocols and we write it down, that perhaps people will be less inclined to manipulate their results differently when the studies are completed. So I'm just going to start by talking a little bit about a systematic review proposals. Again, it really states the intention of the review group. And I think it's a document that needs to be written prior to starting a systematic review. And you may think that's awfully odd of me to say that, but we do have examples of people writing protocols after the research is done. And why are they doing this? They're doing it so that the protocol matches the completed review. So there again is some unfortunate manipulation of science, and we need to guard against that. And that is problematic. I wanted to alert you to PRISMA-P. It's really primarily for systematic review proposals of clinical intervention evaluations. Although I think probably if you were doing a preclinical systematic review, you could consider to use it. There is another group called Camrades that I can't remember whether they've got particular guidance on protocols for animal reviews or not. So I think PRISMA, we certainly set out looking at clinical interventions. We want to pre-specify the review process. We want to really reduce post hoc changes. And while it might be reasonable to make post hoc changes, often what we find is these changes are made without attribution. So we don't know why people have made changes. All we know is that changes have been made. We really need to consider what are the primary and secondary outcomes, and we need to really tell the reader about changes between the protocol and the completed review. We have an obligation to tell readers that information. And importantly, we need to sort of register our protocol and make it accessible to people who might be interested in what you're doing. So we've published the PRISMA reporting guidance. We've also published the PRISMA protocol explanatory paper. And here is an example of the checklist that goes along with the PRISMA P. So I will just give you some examples. One is we want authors to identify it's a protocol of a systematic review, and we want people to do that so that when you're searching to identify protocols that you can easily access that information. We also recognize that some protocols are updates of reviews that have been done, and again, if that's the case, we want authors to tell readers that information. We want, if the authors of the protocol have registered it, we want to know where the registry is. We want to know the name of the registry as well. And so there's been a lot of research looking at duplication of research. And very recently, if I would encourage you, John Ioannidis has written a very nice piece in Millbank Quarterly, really showing some very significant problems on sort of the duplication of research. We wrote an editorial about this alongside the paper, which we sort of call it mega silliness. There's a lot of really crazy things going out there, and it's incredibly wasteful, particularly for funders. And we need to really work at collaborating together and stop unnecessary duplication of effort. So where would you put these protocols? Well, Prospero is an international registry for systematic review protocols. It's accessible, it's open accessible, it's free of charge. Other venues would be Open Science, the Open Science Framework, which is a repository. What I like about Open Science Framework is that it records every step of your research, whether that's a systematic review or a clinical trial. Every single thing is put into the framework, and it's a very, very interesting repository. Most universities have open access repository, so you can put your research there. I don't believe publication is the bottom line. I think accessibility is the bottom line. You need to make your work accessible for people so they can see it. Systematic Reviews publishes protocols of systematic reviews, as does BMJ Open and lots of other journals as well. I'm going to skip this a little bit because it's simply along the same lines of each piece of information we're asking prospective authors to provide in the protocol of a systematic review. I'm going to talk now a little bit about the Spirit Statement, which is a protocol for a randomized trial. And here is the Spirit checklist. It has 33 items across 5 different categories. I'm not going to get into the sort of the details about each checklist item. What I'm going to refer you to is the Spirit website. They have published the Spirit Statement, which is the reporting guidance and includes the checklist. And they've also published an explanatory document, which is a very long document, as providing examples of good reporting, and also examples and also the evidence underpinning why we want people to report information about protocols. So where can you register clinical trial protocols? Clinicaltrials.gov is by far the largest registry. It has over 100,000 registered trials. I am obliged to mention ISRCTN because I'm part of the advisory group. It is also a very good registry, but it does not have nearly as many records. But there are lots of places that you can register your trial. And again, it's very important to register your trial. It's very important to make this information available to people. Again, you can make your trial protocol available. If you don't want to put it on clinicaltrials.gov, you can make available on Open Science Framework and any university open access repository. So there's really no excuse in 2016 for hiding what you're doing and not making it available, particularly if it's research that is being funded. So I had a little look around, and I noticed that University College Cork has a repository. So for those of you who are based here, and I suspect that any other higher level institution in Ireland, you can put your repository there. I think all of the information in these repositories is picked up by Google Scholar. So if you're interested in metrics such as your H-index, all of that information is picked up by Google Scholar, and it is all translated into your H-index. So, you know, maybe that's important for you in terms of your academic promotion. Again, I think I'm not going backwards. So if you want to publish your protocols, you can certainly go and try to publish them in Trials. Is a journal. I think at least 50% of what they publish is protocols. Again, BMJ Open publish protocols of randomized trials, and lots of other journals do. So I would encourage you to move in that direction. I'm going to end very shortly. I did want to give a shout out to the Peer Review Congress next year. And I would encourage you to go if you've not been before. It's a great venue for understanding publication science and the world of trying to get published and what's involved with that. And there's lots of interesting people at that meeting and lots of interesting presentations. I'm going to end with this. For those of you who don't know what this is the Temple of Heaven in Beijing. Two interesting things about it. It's a clear day in Beijing, which is very unusual. And I think if we can get more transparency and completeness of reporting in terms of completed research, and if we can get protocols made available, we will get a little bit closer to heaven. So thank you.